I want to thank you in advance for your participation. Today is what we're calling Telehealth Tuesday. And this is something that we're trying out tonight to see how it's going to go. I have Dr. Michael Bookhart on with us tonight. And I'm going to, now that he has his phone set up, I'm going to allow him to tell us a little bit about himself before we go into the questions. Dr. Bookhart?
Well, again, sincere apologies. I think, this is sometimes what happens in the first time of blues, and I'm really hadn't done as much on the lives as you, Tracy. And I know everybody's been eager to get on here. We have been. So again, apologies to all the viewers out there. I hope everybody is are they still there, Tracy?
They are still here.
They're still there. Okay. Thank you all so much. So my name is Dr. Michael Bookhart from Orlando, Florida. I've been here in Mississippi and Jackson for since 2013. Came here for residency in family medicine at UMC. Finished that in 2016, and I've been practicing as a hospitalist physician up with Merit Health Hospitals up until basically about a year ago. We opened Good Faith Wellness Center, which is a combination practice, a multidisciplinary practice that is comprised of myself, Dr. Torrance Green, who's an internal medicine physician, board certified, and also Dr. Sophronia Stidwell, who's a board certified chiropractor. And so we're located 2506 Lakeland Drive in Flowood, open for appointments, taking appointments, and we'll get into all that later. But that was just a little bit about me. I know we're pressed for time.
Okay. So with that being said, Dr. Bookhart, we're going to jump right into the questions to see if we can just keep this within 30 minutes.
Okay.
And I have a few questions here already. And the first one is, for the past few months and intermediately, when I bend over to the left side, I feel a dull ache in my left upper quadrant below my left breast. It only lasts for about 2 to 4 minutes, but it starts slow, increases in intensity, to make me pause and just stop suddenly, almost like spasms. And for the past week, I have awakened with acidity secretion in my mouth. I've read up on it and attributed it to GERDs. There are no other symptoms. Do you think it's something I can just take an acid for? I hate going to the doctor. I have no other medical conditions besides obesity, and her blood work is within normal limits.
I would say, Tracy, and I appreciate that question. Did this particular person give any demographics like their age or anything like that, or
No,
possibly how much they weigh? Nothing like that.
no. She just said she deals with obesity.
Okay, okay. I'm just gonna put something in right here. 1 second to just see if we can get some more folks that were on my. I'm going to answer that question just a second. We're just trying to get
Okay.
some more folks that when sent me messages personally saying that they couldn't see us.
Okay.
Let's see. Okay. Um, now, and you told me that in this, you were saying that the young lady said the pain was starting where on the left side, was it back?
Yes, it's starting on the left upper part below the left breast.
Below the left breast.
Mhm.
Okay. So, there's a couple things here that you have to be concerned with. And by the way, Tracy, I appreciate you sending me a few of them beforehand. On this one, we just said our prayers and we said we're going to go with it. So I remember looking at this one, but I did not go over the other ones because I just
I
wanted to
have
go
the
with.
age as well
Oh, you do
now.
have the
Uh-huh.
age?
The age
How?
is 47
47. Okay.
and the weight is
Okay.
342.
Thank you. So that's and the reason why I asked that is because you know, the weight, basically the BMI, body mass index. So when you're looking at somebody's weight, you're looking at their genetic makeup, uh, their race, all of that plays a factor into the answer here. But and the reason, especially, I wanted to know about the age is because, especially women in their 40s, one of the main concerns is that a person in that age is at high risk, especially, I'm assuming we're talking American. And so at risk for heart disease. And so one of the things with female patients, unfortunately, a lot of people attribute things to GERD and acid reflux, but this could actually be masking something more serious, like heart issues. It doesn't sound like this person is necessarily suffering from a heart attack. They would have other symptoms, sweating, nausea, chest pain, shortness of breath, all that.
Mhm.
But they also could have some issues from a cardiac standpoint, like I said, with some previous heart damage, or could have some other conditions that certainly need to be evaluated. But usually the most common answer, yes, would be GERD or acid reflux. That is treated by a number of things. You can elevate the head of the bed up. So instead of sleeping, as we said, supine flat, elevating the head of the bed, that helps. Eating before 6 p.m. Sometimes people move it to 7, but eating before dusk, so the body has enough time to actually digest the food. And sometimes a person can, maybe they'll even have a bowel movement before bed. So adjusting those eating habits, adjusting what you're eating. I know in the South, a lot of people like to use hot sauce and different things like that and other additives, heavily seasoned and salted foods. And so even without medication, the conservative therapy is to, like I said, eating earlier, not eating late, trying to stay away from snacking, being careful about the acidity of your food, or adding certain things like hot sauce, Tabasco, all that kind of stuff. And then, of course, yes, medication like PPIs, proton pump inhibitors like omeprazole, which Prilosec is a Prilosec OTC. You've seen the commercials. Protonics, which we use in the hospital. And then last but not least, the more concerning things with an African American female in her 40s, overweight, likely obese, and especially if this person has other risk factors like hypertension or diabetes, we would be looking at potential heart issues as well.
Okay. All right. She just added and said that there are no other symptoms. She just started Ozempic.
Okay.
Um, she was sitting up and she stopped eating at 7 every night, and she's just started her weight loss journey.
Okay, excellent. And look, I want to congratulate this young lady on that.
Yes.
That takes a lot of courage to come
True.
on,
Yes.
come and asking us questions, submitting the questions to us. We really appreciate you coming forward, and hopefully we'll get a chance to meet you at Good Faith Wellness Center in the clinic. We are piloting this tonight. As you all can see, the devil was busy, but he was not going to be the victor.
He
And
was not.
so we are on here, and so we'll see after we get done tonight. We'll see how we're going to move forward with this in terms of making this a weekly thing or bi-weekly. But I would advise that the young ladies watching, we would be more than happy to see you in the clinic as a patient, and we would also be more than happy. We hope that you would come join us again for the next Telehealth Tuesday. That'll start promptly at
It's
6:59 p.m. Come on, somebody.
all right now. So let's go on. Seems like she's very pleased with the answer that you've given her. She said, "Thank you very much." All right. So the next question I have, it seems like two people have asked this question. What are some meds that can be given to prevent migraines? Or and also what are some medications that can be given to help them rest at night? They've tried a lot of different things for the migraines, and they're looking for maybe some different things that they could try.
Excellent question. Migraine disorder is something that's very common, and unfortunately, I've never suffered from them, but I've definitely treated uh, tons of patients with migraine disorders. This is something that, just to give a very brief background, migraine disorder, something that's brought about in the most Americans by stress. Western civilization, we have a very high stress lifestyle. A lot of people are working more than one job. They're working extended hours, extended meaning over 8 or 9. Those of us that work 12-hour shifts, people who work overnight, all of those are things that increase your stress level. Certain hormones, different things are secreted, and that adds to it. And then on top of that, which again, for the most part, I'm assuming we're talking about African American,
Mhm.
and being here in Mississippi, with the Southern lifestyle and all that good food. So most likely adding to the family history of hypertension, which is elevated blood pressure, diabetes, and all those things, just more and more risk factors. And so when you have a history of migraine disorder, a lot of times that comes from the blood vessel itself either expanding or collapsing. Both of those things can cause headaches. And so, especially in the setting of a patient with uncontrolled risk factors, especially high blood pressure, smoking, specifically cigarettes, I'm talking about specifically. Those are all things that contribute further to that. And so, to answer the question, the medications you can take, of course, the number one thing we always recommend in the guideline directed therapy for most conditions is conservative. So, for example, a lot of migraines, sometimes depending on how severe, they go away on their own. If a person steps away from potentially whatever the stressor is, maybe they're at work having a tough day, maybe they're working too many hours, they might have stressful life at home, kids getting on your nerves, whatever it is, spouse. And so they just take a moment, step aside, maybe in a quiet room, dark room especially, getting away, maybe soothing sounds like when you're at a massage place, or just straight up quiet. For a large percentage of patients, that will help alleviate a lot of their symptoms. But if you're a chronic person, person that suffers from chronic migraine disorder, then you have something like over-the-counter drugs such as Excedrin migraine, which has caffeine as one of the active ingredients. Mm-hmm. And for some unknown reason, caffeine is something that has helped people control headaches since this drug was invented, since we knew about the properties of caffeine. And so that's one of the easiest and most obtainable way. Then there's other drugs that are prescription drugs that you would need to see your provider, like those at Good Faith Wellness Center, that if you're a candidate for that, Topamax, different things, other controlled substances, Maxalt, it can be given sublingually, meaning under the tongue for rapid, so that it can enter the bloodstream rapidly and help you control your symptoms. So those are the pharmacologic ways of treating with drugs. But as we always stated, we try to start with the simple things, then we go to over the counter, and then there are multiple prescriptions, drugs, and also antidepressants that help with that.
Okay. All right. Thank you for that answer. I should have asked this one after the first one because it is related to the weight loss medications. What are your thoughts on the different weight loss medications, such as Wegovy and Ozempic? And do you prescribe these?
Yes, we absolutely prescribe these, and we get tons of questions about these. These, probably two of the most popular new drugs that are out there. It's one of the hottest topics in medicine. Yeah. And of course, people, earlier we were on the show with the Literacy Hour with Dr. Liddell. Mm-hmm. Shout out to the Literacy Hour, where she was educating the public about COVID and the fact that we've seen mutations in it. So, but anyway, that's another topic. Going back to the other hot topic, weight loss. We certainly do that. We have a new weight loss program at Good Faith Wellness Center. We're trying some different things. This is sort of a pilot in itself as well. What we want to do ultimately is have the medications there. Sometimes they've been very, very difficult to get and have been very expensive and almost unobtainable for patients. Right. Because of the cost, yes. Cash price being over $1,000. Sometimes if you have, depending on your pharmacy or the coupon, 500. And so that's been something that's kind of prohibited patients from being able to get on these new fascinating medications. But my thoughts on it, we've definitely prescribed that to several patients. Mm-hmm. I don't have a ton of patients on it because we more recently started our weight loss program, but mm-hmm. I think we've had some significant positive results. I saw a patient actually just today who's mm-hmm. been on it for several months, and this particular lady, I believe she lost, I think we're at about 30 pounds okay. or so. 30, 35 pounds. She's very happy with it. Uh-huh. They can be used in combination with others. So they do have certain side effects. We can get into that at another time, or if anybody comes to the clinic and desires to discuss, we can get into those details. But personally, with my patients, we've seen nothing but good results.
Okay, that's great. Now, yeah, I know that a lot of people are having trouble with the cost. They're having trouble with getting the insurance to cover it, different things like that. I know that Blue Cross Blue Shield is one of those that don't really want to pay for that. But I know that there are also ways to get that done. But yeah, that was one of the main questions. All right. So we're going to talk about COVID since you mentioned
All
COVID.
right.
The question is, with COVID on the rise again, what are some preventive measures that you would recommend?
Preventive things, and I'm so glad that you asked this question, Tracy. And again, we did talk about this on the literacy hour. Uh, number one, uh, Number one, like I said today earlier, COVID is a real diagnosis.
Yes,
So this, I don't know where these rumors came from. You were even seeing this from politicians,
yes,
these guys on CNN, C-SPAN,
yes.
whatever, Fox News. You saw that. You saw it in even in the hospital. And I was telling when I was talking with Dr. Liddell on the literacy hour earlier. Um, to my absolute disbelief, even being in a hospitalist working in South Jackson, I remember being in the ICU. There were
Uh-huh.
two family members that were on ventilators, breathing machines, on life support, fighting for
Uh-huh.
their life, positive for COVID. I believe one of them might have also had the flu as a secondary infection. But there was a nurse who actually came up to me and asked, and she was treating one of these family members, uh, is COVID a real diagnosis?
Wow.
Yes, it
It
is.
is real.
So
Mhm. It is
please
definitely
listen.
real.
Yeah, absolutely. And I think a lot of us, and probably even healthcare providers and professionals included, because we've seen such a significant decrease thanks to the vaccine and thanks to hand washing, mask wearing, other techniques, a lot of people probably have taken this for granted. But make no mistake about it, COVID is real. These mutations are real. This is something that unfortunately we're going to have to learn to live with,
Right.
as
Because
common
it's
as the
not
flu.
going anywhere.
Yeah. So those things, to answer your question, number one, if anybody is sick, looks sick, especially if they have a fever, they need to stay home. You
Uh-huh.
need to stay as far as you
Stay
can away
home.
from them. And if you're in the same house, I hope you've got space enough to go into another room and just let that person basically quarantine, just as we were doing before. But
Yes.
universal precautions, meaning what we do with every patient in terms of gloves and all that stuff.
Uh-huh.
I would say if you're in any enclosed spaces, you're on a plane, train, bus, whatever, working in close quarters, wear your mask. Number two, hand washing.
Hmm.
Number three, stand at least 6 feet away. Same stuff we were talking about before. Number
Yes.
four, sanitizers. And again, going back to what we said first, COVID is real.
COVID is real. So you answered the second part of the question. The second part of the question was, what was your take on mask wear? Because we hear some people say that the masks don't do any good, but then we have the majority of people who say that the masks do help. So with your answering the original questions, you do feel that mask wearing is a good preventive measure.
Well, absolutely. I mean, I do personally feel that, but also we have a
Mhm.
significant amount of data
Uh-huh.
that shows that as well. And, when COVID when we first came out with everything and this terrible pandemic was first discovered, um, you know, there were different thoughts on that and the fibers in the
Mhm.
mask.
Mhm.
So of course, the premium way, the
Mhm.
best mask is of course an N95.
Uh-huh.
Those are the masks that are the most uncomfortable, pressing
Yes.
against your face,
Yes.
put two straps
Squeeze.
over, and they
Mhm.
have different ones like the duckbill and all that. So certainly, and those are, I mean, not nothing is 100%, but
Right.
those are pretty darn close to it. But
Okay.
if the only thing you can get your hands on is a simple surgical mask, even those don't allow droplets to come in, and that droplets being a certain size as compared to the N95. The N95 lets fewer particles come through. The surgical mask or simple mask does allow, there are certain airborne or respiratory
Mhm.
things like tuberculosis that would still go through it and infect people. But per the CDC, guidelines, this was deemed to be a droplet spread disease.
Hmm.
I still have my own thoughts on that.
Yeah.
But in terms of guarding against droplets, even just a simple mask will significantly
Yeah.
reduce your chances of contracting COVID.
Okay, so people, what we're going to take away is stay home if you're sick. Number one, you know when you do not feel normal, stay home and do not make everyone else sick around you.
Please,
And wear your mask. And please wear your mask and wash your hands.
please do. It's as
How-
simple as that, Tracy. It's
Right.
simple.
I mean, it's not rocket science. It's real. Like you said, it's real and it's here to stay. It's not going
Absolutely.
anywhere. Right. All right. So the next question is this one I did not send you earlier, but they wanted to know, could you give something that will cause burning eyes? They're having problem with their eyes burning all the time.
Hmm. Uh, man, that's one of those tough ones, because it's such a kind of a generalized thing. Probably be helpful to have a little bit because, the thing is when we have medical students and things like that, one of the most important things is the history taken.
Okay.
So, for example, burning eyes. Probably one of the first things that medical professionals, you would think of is could the person have some type of allergies? The other question would be, when do these symptoms actually start? Is this something seasonal? Does it
Mhm.
get worse in the spring and all this pollen is around, or is it worse during the cold times? Uh, are they short of breath with this? Any other associated symptoms? So, there's really not one answer for this, but
Okay.
burning eyes. So the differential diagnosis, which is what doctors do, and they ask questions, they're trying to generate a differential diagnosis, meaning, what could it be? A set of different things and causes. So one of the causes would be allergies.
Mhm.
So we would need to get a focused history taking, find out when this happens to the patient. Are there any family members who have eye problems or anything else like that? They have actual hay fever, runny nose associated. Another thing that could it be, something that they're just is it something more like a contact issue where
Okay.
sometimes hair products or colognes or perfumes and things like that sometimes particles or whatnot can start making somebody sneeze, or even literally every time they apply something or makeup or
Yeah.
mascara could
Yeah.
literally be getting in the eye. So that would be questions about what's your normal regimen and what time of day does this happen. Another thing is, could there have been any type of trauma? Uh,
Mhm.
was a person in, did they have a fall? Were there any kind of motor vehicle accident
Mhm.
anytime in the last year or so where they struck their head? Could there be any issues coming down to the eyes? I mean, that was a little bit more far-fetched, but that could be possible. And
Right.
then of course the other big one that you'd be definitely worried about would be conjunctivitis or pink eye. So again, how long this has been going on? Is there anybody around you that's sick? Any sick children?
Mhm.
Things like that. So we would just probably need
A little bit
a
more
little bit
information.
more history, a little bit more information.
Okay. All right. The next one is this person wants to know they've been on blood pressure medicine for years. They're currently taking two different medications.
Mhm.
Do you think that there's ever a chance that they will be able to stop the medication and control their blood pressure using diet control and exercise?
Oh, absolutely. And did you say that this person has been on blood pressure medicine for how long? Did you say how long?
It's probably been about 10 years.
About 10 years. Yeah, absolutely. And, that's one of the things that unfortunately I feel like a lot of medical professionals, nobody in particular, but a lot of medical professionals, um, and we're trained in allopathic medicine. We're trained, you know, drugs, 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 drugs. And now the
Mhm.
answer on the board exam, yeah, because we're all board certified, the answer on the board exam is always going to be dietary changes, lifestyle changes, or
Mhm.
modification, meaning weight loss,
Mhm.
changing your diet,
Mhm.
trying as best you can to somehow improve your stress level. Whether that's working, if you work in an overnight job somewhere, one of the factories or the hospital,
Uh-huh.
if there's a way to get, because unfortunately, I know a lot of people like that nighttime money, but working overnight
And not just
significantly
sleep.
decreases your lifespan. And it's
Yes.
because it throws off the circadian rhythm of the body. It throws things off, and we're not, human beings are meant to sleep uh, at night. And so those different, I would just say, depending on the person, depending on what they do for a living, what time they work, what is their stress level, what is their weight, what
Hmm.
risk factors they have. We know they have
Hmm.
high blood pressure, but
Right.
do they have diabetes as well? What are they
No.
eating?
Okay. Yeah.
When are they
Yeah.
eating? Yeah, so those are the things. But the straight answer is definitely yes. We
Okay.
now, if it like I said, depending on what's going on and how many medications they're on, a person may not be able to, like, say if they're on 4 or 5 blood pressure.
Uh-huh.
Well, I'm confident we can cut that in half. I'm confident, and
Uh-huh.
some people can certainly come completely off. But
Right.
if you've been on it that long, you got other risk factors, a strong family history, you might end up being on at least one or so,
Hmm.
but definitely the first thing we're gonna do when you come to Good Faith Wellness Center, we're gonna try to get you off as many medications as possible.
All right. So I do see a question on there. I have one more here, and it says they have the right ear pops when they swallow,
Mhm.
and they have a lot of drainage. They've been given a lot of different things to try to get rid of the popping of the ears and the drainage, but it only works for a short period of time, and then it comes back. What do you suggest?
Well, that's another common one. All of that, everything from that ear, the inner ear coming on down, those things are connected, to the pharynx and all that. And so that's why when people have a lot of issues with the ear, and you'll hear them trying to scratch and clear their throat, a lot of mucus and drainage, and all of this is affected because through the eustachian tube,
Mm-hmm.
the anatomy of how the good Lord designed us, all that's connected. And so,
Uh-huh.
this would be another thing where a lot of people suffer from this that do have chronic allergies. A lot of people suffer from this that could be smokers, especially again cigarette smokers. If they don't have either one of these and they just kind of suffer from it, and then we talk about post nasal drip. You look in the back of their throat on exam when you come into the office at Good Faith Wellness Center, and you look back and you see kind of what we call cobblestoning and mucus deposits back there. Then those that can be treated usually conservatively with an antihistamine such as Claritin, Zyrtec, or Allegra. And a lot of times that may help this dysfunction going on. It also may be some inner ear issue. And then
Mm-hmm.
other times it may even be some type of ear infection. And so again, that would be, those diagnoses would be made in a medical setting, looking into the ear with an otoscope, taking a look, making sure there's no acute infection, looking in the throat, making sure there's no sign of redness or trauma to the throat. Just so many things that can cause that. But usually that can be treated conservatively with medication.
Okay. All right. So the one that we have here, the last one that we have that was just asked, and I think this is a great question. She said, what are some good vitamins or medications for teachers, assistants for the new school year, and also for children going back to school? As soon as school starts back, we know that crud starts. I just dealt with that with my son on last week.
Mhm.
Um, all of the kids in the school have had some type of bug. So, with that being the case, the teachers are getting sick. What's something that you could recommend that they can take that will probably help them, I guess, build their immune system?
That's a great question. I think the teachers, so the question is the teachers concerned about all the kids coming in.
Hmm.
So what can those teachers take to fight, make
Right,
sure that they're
right.
armed with okay. Um, there was a vitamin called Airborne
Hmm.
that was really very popular some years ago. It's still on the market as
Yes.
far as I'm aware. So things like that, it has a significant amount of different vitamins, antioxidants in it. And it's really even this is not a plug for Airborne. These are different things that you can get by just getting the individual vitamin.
Uh-huh.
So vitamin C, number one, big one, 500 milligrams of vitamin C over the counter. Man, you can't go wrong with that. Another thing which helps with overall other issues that, the fact that people that work inside, like us, that work in hospitals and clinics, and of course these teachers, these days we all know that unfortunately it's not like when we came up, when we had recess and people
Yes.
were
Yes.
allowed, nowadays these kids are either on a game system, not going outside. So a lot of people are deficient in vitamin D. And so that's another good vitamin to have on hand. There are other things such as turmeric. You've got, uh, garlic and stuff like that. You've got echinacea, which is extremely important and helpful, especially when people do start getting the crud, or they have this cold or whatnot. Echinacea is a lifesaver. And then, so, you go to the local GNC, places like that, and those
Mm-hmm.
guys have like some incredible vitamins. And then you've got, the daily multivitamin, you've got Centrum. And then, like I say, GNC, it has some, that has some vitamin packs that are particularly
Okay.
aimed at making sure that you can come, fight off these viruses. And it's like a pack, and
So the
it'll be several
different ones.
capsules in a pack, and you take all of that every single day.
Oh wow. Okay. Yeah, I've seen those. I've
Mhm.
seen those. All right. He asked about zinc.
Zinc, zinc. I meant to say zinc and elderberry. Zinc, elderberry,
Oh yeah,
echinacea, vitamin C, vitamin D. You can't go
you can't
wrong.
go wrong. Okay. As I'm trying to wrap it up, there's another question. Hey, but that's a
Come on,
good thing.
come on
I
with it.
mean, hey, that's what we're here for.
That's right.
Um,
And look, excuse me, Tracy. Look, I know, to no fault of anybody in particular, but we're about 30 minutes behind. But hey, if everybody is still out there in TV land,
and they
and,
still
and
have questions, we're here for it, huh?
I'm here for it, Tracy. I don't get paid by the hour for this, honey.
And then we're gonna keep dropping once they come to see you at Good Faith Wellness. We can get more information on these things and get them taken care of.
There we go.
What's your slogan again? What's your slogan?
True wealth begins with good health.
Okay, so the next question is there such thing as taking too much vitamin D?
Excuse me. You'd have to take, I mean, like, because really, like, saying if renal patients, with basically patients, we say renal with chronic kidney disease,
Uh-huh.
that they are nearly 100%, especially dialysis patients, always going
Uh-huh.
to be deficient in certain things like erythropoietin, vitamin D. And so that's why those patients are usually on 50,000 units of vitamin D per week at times, for a total of 8 to 10 weeks. So I would say that not really, but if you're going and sitting taking, 100,000 units, I mean, then yeah, that's
Yeah,
overdoing it. But
that's a bit
yeah,
much, huh?
but if you're
Okay.
taking like 4,000 international units, something like that every day, oh yeah, that's fine. Even 8,000, that's totally fine.
Okay, we have a viewer that says they need an appointment. And that's a great thing.
Woohoo!
So we're gonna talk to him offline and we're gonna get him set up to become a patient of yours. And that's kind of
Awesome.
like that's also the intent of the Telehealth Tuesday is to help those that are looking for a new physician to come and see Dr. Bookhart. We're also here to help our community, make them aware of some things that they just may not have anyone to ask. They may not feel comfortable asking anyone. And we want you guys to know that we will hold this to the strictly of confidentiality when you send it to me personally. I work in the healthcare industry, so I don't play with people's confidentiality. If you don't want your name, if you want to come on live and do it yourself, I'm fine with that. But if you want to keep it confidential, I will keep that strictly between me and Dr. Bookhart. I don't even think I've given him anybody's name. So,
Okay. Yeah,
so yeah, I
Tracy.
just gave him the questions.
Okay. No, right, absolutely. And it seems like that's working well. We would certainly welcome anybody who want. I think you have the ability to add another, right? All the trouble I had with adding. But you can
Yes,
add
yes.
people on it,
I
right?
can add people on and they can come on and ask their questions and talk directly to you. If they
Okay.
now in that instance, your face will be shown, everyone will know who you are. So that is strictly up to you if you would like to appear live on the broadcast. We do not have a problem with that.
Yeah.
I see someone says they have an appointment with you on Monday.
They got an appointment. Wait, let me go to my schedule now. No, we are looking forward. We're looking forward to seeing you.
Yeah,
Real quick, I just wanted to say, Tracy, that man, I don't know about you, but I'm so grateful, that to have people here with us on this
yeah,
that want to hear this. I was thinking, I was talking to a couple of buddies, and I was saying, we, I say, well, let's see how the turnout goes, but if we don't get the turnout we need, we may have to start just going and talking about Black folks and relationships. That's always a hot topic and stuff like that. But so
yeah. Try
I'm just
that. Been there, done that. They don't want to hear that either.
down on
Huh.
yeah. But yeah,
Yeah,
I
they
was
don't
gonna
want
but
to
I
hear
was gonna say, on a serious note, um, you mentioned something that's so crucial, so important, that a lot of times people don't get a chance to ask these questions
that.
of
Right.
medical professionals, and especially here in Mississippi,
Hmm.
right here in Jackson. Um, a lot of people just are not able to either afford healthcare insurance,
Right.
either that or the job done provided, or they might have gotten laid off, or whatever the issue. And then there's a lot of people, and especially our Black men, who are just simply scared to come to
To,
the
to
doctor.
do.
But like I said, we were with brother Doug Williams and Felicia Williams on previous weekend, and I did a talk, and it was called An Annual Exam or a Ticket to the Grave.
Mm,
The choice is yours.
yeah.
And so we did a talk on that, and I started it off talking about a gentleman who had undiagnosed diabetes. And long story short, he came into the hospital in South Jackson and died about a few hours later. He
Mm,
went into a coma. He's obviously he stopped breathing, all this good stuff. We had to put him on a ventilator machine. He coded out.
mm-hmm.
We did everything we could to save his life. His blood sugar was 1,710
Oh,
when he came in,
wow.
the
That's
highest blood sugar I've ever, high as hell. And so the thing is, I'm just saying that you said a lot of people don't get a chance to ask these. Please, you got to come in, good people. And look, the other thing is probably a shameless plug, but they don't have any excuse at Good Faith Wellness Center, because
that's
even if
right.
you
I was
don't,
going to ask you about that.
right, even if you don't have health care insurance, we have plans. We've got our own plan. This is not a substitute for health care insurance, but with these plans, you go to our website, or maybe after we're done, we'll
Just
mention it to the good
drop
folks
that
here.
link.
But yeah, you come on in. There's no qualifying. You don't have to get no blood drawn, whether you smoke or not, whether you on drugs or not. It don't matter. You come in. It's a recurring fee every month. You get charged just like a cell phone bill, and for that price, depending on what you choose, you can see us as many times as you want. You can come every day, literally.
I
So nobody
think
has an
that's
excuse.
awesome. I think
Nobody has
that's
an excuse.
awesome. So I want to reiterate what Dr. Bookhart just said. You have no excuse. Um,
That's right.
You can go in, you can get on a plan that they've already laid out for you if you do not have health insurance, and you can still be seen. Actually, you could go every day if you need to go. I hurt my toe today. I want to go to the doctor. You've
Come
already
on.
paid for it. So, hey,
Come
just
on.
go.
Come
I
on.
have a headache. My eyes hurting. You could have whatever going on and still get to see the
That's
doctor.
right.
So I think that's an awesome thing that you all are doing with that plan, because there are a lot of people who don't have health insurance,
That's right.
which is, so that's a good thing. I have someone else that said they'll be calling you soon. So, hey, that's really good. Mission accomplished,
Oh
huh?
yeah.
Yeah, and
Awesome.
then we're gonna keep spreading the word about this. We're gonna talk more about this. We're gonna keep putting the word out there for those that's on the live tonight. Again, I want to thank you guys for being patient with us. It's the first time, things happen like this. But hey, in the end, we rocked and rolled and we got
Yeah,
it done. We got
absolutely.
all of the questions answered. We even had time for questions to come through on the live, and I appreciate you guys so much for that. I appreciate you hanging in there with us, Dr. Bookhart. I thank you for being here with me tonight and taking the time out of your busy schedule to help educate our people. to answer these questions that they're not comfortable with. Um,
Absolutely.
I think
Yeah.
it's amazing
Yeah.
what you're doing. And I just want to say, keep up the good work, sir.
Well, thank you so much. And look, I appreciate you, Tracy Michelle, for being so kind and gracious to host Telehealth Tuesday, and appreciate you having the patience, and all of our viewers that are here that have stayed the course with us. We really appreciate you guys. It's such an honor to be able to do this in my life's work, and I really feel like it's my calling.
Mhm.
And we are here for you. We will never compromise when it comes to your health. And people that know me personally, they know, even from personal stories, that those of you that know me closely, no matter what the sacrifice is, we're going to do the right thing for the patient. We're going to do the right thing. And
Oh, all
we
right.
just,
So before we Oh, thank you guys so much. They was like, this is good stuff. Someone said this is a great and great. It was great and very informative. So that's what I was about to ask, guys. Drop in my inbox. Tell me your thoughts. Give me your feedback. Give me your questions. This is something that I enjoy doing. As you guys know, I am a talker. I love to talk. I love to communicate, and I love to help people. So,
mhm.
with that being said, this opportunity means a lot to me, and we're going to just keep working on it and make it better and better each time. Dr. Bookhart, before we go, I want you to give them your information again and anything else you want to add before we go.
Yeah, absolutely. Well, again, I just want to say thank you to you, Tracy, and everybody who has been here asking some wonderful questions. Um, this is something that I really feel is needed. You and I talked about it. We prayed about it. This is something that's needed. This is information, like you said, that people won't normally get, and even the folks that may only get it from being on this live with us, even moving forward. Maybe these folks just are not able to come, and
Mhm.
but even with that, I feel like this is helping our community one person at a time. And the other thing is, um, I think that we should all just make sure that we are making sure to tell our people, tell our family members, our church members, everybody, that primary care, getting screening, all this stuff is so, so important, because it would be terrible. It would be looking pretty crazy to die from something that could have been prevented. And so, like I said, the choice is yours: an annual exam or a ticket to the grave. The choice
Yes.
is yours. And so, with that said, we are located at 2506 Lakeland Drive, Flowood, 39232. Area code 769-487-6036. We are Good Faith Wellness Center. My name is Dr. Michael Bookhart, and my partners, my colleagues are Dr. Torrance Green, MD, PhD, a board certified internal medicine doctor and nephrologist, which is a kidney specialist,
From
and also Dr.
Bolton, Mississippi, might I add?
That's what's that? What's that?
From Bolton, Mississippi, may I add?
That's
My
right. He is from
hometown.
Bolton. He is from Bolton. I'm on. This is going to be recorded, right? You got to send it to him.
Okay.
And Dr. Sophronia Stidwell, fantastic board certified chiropractor, but who also goes the extra mile with her patients to looking at nutrition and some weight loss and some other things as well. And we're working together as a tandem unit. We've got wonderful people in the office. We've got Miss Legarius Love. We've got Miss Paula, and then Miss Tracy, who are helping us, and we couldn't do anything without them. And thank you all, everybody. Thank you again, Tracy. And remember, before we sign off, true wealth begins with good health.
All right. Thank you guys, and you guys have a good night, and we'll see you next time.